I present to you all-in-one Toric solution which is made in India, LED-based topographer. This system functions as an anterior surface topographer. Unlike traditional methods that use a Placido disc, our system employs 600 color LEDs to measure the central 9 to 10 mm of the cornea. It provides keratometry readings in the 3, 5, and 7 mm zones. Additionally, this system is designed as a manual image-guided system, facilitating easy and accurate marking of the toric lens alignment axis. This method eliminates the need for preoperative markings but requires intraoperative markings just before rotating the toric lens. Traditionally, two methods are used for axis alignment of toric lens. Manual marking method. While economical, this is a three-step method that can be tedious and prone to errors. Head tilt error is due to discrepancies in head position during keratometry and reference marking. Smudging or wipeout of manual markings may occur. Cyclotorsion error occur if preoperative reference marking is not done. Image-guided system. This single-step method is precise, easy to use, and error-free, though it is more expensive. By combining manual marking method with the image-guided system, we have developed the manual image-guided system. This system eliminates the need for preoperative marking at 0 and 180 degrees. Instead, limbal structures visible on the topography image serve as reference points. During surgery, these limbal structures are used as reference points and manually marked. When comparing the manual image-guided system with the traditional image-guided system, both methods are error-free and straightforward due to their single-step approach. The manual image-guided system is also more economical. I will demonstrate the system using the following case. The system is an anterior surface topographer that uses 600 color LEDs rather than a Placido disc, measuring the central 9 to 10 mm of the cornea. Here are the results. The raw image shows a white-to-white measurement of 11.66 mm and an angle alpha of 0.45 mm. The anterior surface keratometry is measured in 3, 5, and 7 mm zones. In the 3 mm zone, there is a 1.1 diopter cylinder at 172 degrees. The steep axis shows no skewing of steep axis, indicating regular astigmatism and can be confirmed by the axial heat map. This is the manual image-guided module. The system automatically marks the steep axis at 172 degrees. In this topography image, identify two prominent limbal structures and mark them as landmarks. On the right side, I have marked a pigmented spot at 179 degrees. On the left side, a whitish pigmented structure is marked at 23 degrees. These two landmarks serve as reference points, eliminating the need for preoperative 0 and 180 degree markings. This method reduces errors from head tilt and cyclotorsion. If the patient moves their head during topography, the distance between the landmark points and the steep axis remains constant, unaffected by head movement or cyclotorsion when the patient is lying down. I will enter the data into the Barrett toric calculator to determine the axis of alignment, which is 176 degrees. Consequently, I will change axis of alignment from 170 to 176 degrees and save this image on a tablet, laptop, or mobile device. This image is displayed in the operating theater on the tablet or mobile device. The surgeon can easily identify the pigmented structure at 179 degrees on the nasal side and the white patch at 23 degrees on the temporal side, and will manually mark these points on the patient's eye. Mark 179 degrees and 23 degrees on the degree gauge. Align these marks with the corneal markings and mark the axis of alignment at 176 degrees. Postoperative day 3, the axis of the toric lens observed on the slit lamp is at 170 degrees, as confirmed by the retroillumination picture. The intended axis of alignment was 176 degrees, indicating a 6-degree misalignment of toric lens. Thank you for your attention.